Ladies and gentlemen, the show is about to begin.
Good morning, good afternoon, and good evening, ladies and gentlemen. My name is Nader Naimurad, and I'm delighted to be hosting this Friday's edition of Beauty Independent in Conversation webinar series, our Spotlight edition. This program is brought to you with the help of two of my indefatigable colleagues, Jane the General Carlson and Alexia Ale Gutierrez Spear, who put together the agenda, the speakers, and all the material that you'll be enjoying today. Speaking of material, for those of you who may be new to this program, we will be sharing a lot of beautifully designed slides. These are hand-drawn, handmade, artisanal slides made in Buenos Aires, Argentina by one Alexia Gutierrez Spear. So you don't want to miss the beauty and the amazing information that will be shared by our panelists. So if you can, please join us using a desktop or laptop computer with a bigger screen. You will have a lot easier time following what our panelists have to say. Now, you are muted. That's because we can't have everyone speaking at the same time, which means if you have a question for our panelists, please feel free to use the comment section within Zoom, not the raise hand section or the Q&A section, the comment section. Just type your question, and our panelists, time allowing, will be more than happy to answer them for you. Now, while you're in the chat section, please don't use it for promotion of yourself or your company. The only person who's allowed to do that is Sarah Trachetta, who is the sponsor of today's webinar. She can promote as much as she'd like to, but other than Sarah, nobody else can do that. Finally, if for whatever reason you didn't get to finish today's episode or would like to watch it over and over again because there is so much good content, you are more than welcome to do so, because a full audio video copy recording of this webinar will be made available within 24 hours of its completion. And thanks to the generosity of Europelab, it will be available for free viewing forever and ever and ever, as long as there is a Beauty Independent. Now, today's episode is part 3 of our product development series that has been sponsored by Europelab. Europelab is a full-service contract manufacturer offering services all the way from conceptualizing your product, developing your formulas, and doing everything from the manufacturing as well as packaging design, etc. Europelab is also focused on working with smaller brands, including indie brands. And so what they want to do is really help people get a better idea of what it means to develop products, especially in general skincare, which is what we covered in our first episode. And then what we're doing is doing a deep dive into niche markets that are high growth markets right now, one being feminine hygiene products, which we covered in January 14th. And today we're going to go into acne. Now, my guest today will be talking about the different areas of acne. So we're going to kick us off with Manon Pion, who is the founder and head of product development at Derme & Co. Derme & Co., you should look them up, is a well-established company in Canada that has their own line of products, including acne products, but they also do contract manufacturing and white label projects for their clients. Manon has a wealth, decades of experience in acne. She has treated acne. She has helped clients and her own company develop products in acne. She's got an encyclopedic knowledge of ingredients, of what you could use when you're developing acne formula. And so she's going to kick us off by providing us an overview of acne, so you have an understanding of the pathophysiology of the disease, how it manifests itself. And she's just going to touch as an example on some of the ingredients that you may want to consider as you go after the condition. We're then going to shift gears and go over to Sarah, who's going to talk to us about some of the fundamentals of product development. So once you understand acne and what you're up against and you want to develop a product, what are the key questions that you need to ask yourself, and how do you go about deciding what type of a product you want to have, what your portfolio should look like, and really balancing a lot of the cost and time requirements that ultimately will drive your decision. Once Sarah is done, we're going to have a real life example from no other than the legendary Dr. Farah from Farah Cosmetic Dermatology in upstate New York. Dr. Farah is part of a practice which is family owned. It's not a family practice. It's a practice that's family owned, specializing in dermatology. Dr. Farah will tell us a little bit about what they do up there, both in their own private practices as well as in the practice that they have in association with State University of New York Upstate Medical Center. So they have a very broad cross-section of patients in pediatrics, in adults. They do a full range of dermatological services, pathodermatological services, as well as aesthetic dermatology services. And what Dr. Farah is going to talk to us about is their experience in developing their own product line. It's not what they set about doing when they first started practicing medicine, but they realized that there was a real need. And as they went about building their own product line, they learned a lot of valuable lessons, real life in the trenches lessons that we wanted to share with you today. So with that said, I'm going to pass the baton to Manon Pion, who has been our spiritual guide through every single one of these episodes so far. Hi, Manon. You're muted, Manon. We can't hear you. We can see you.
I'm so sorry. How are you? Thank you for having me. Once again, I'm very excited to talk about this subject, and especially in presence of Dr. Farah. Looking forward
for those of you who don't know, Manon and Joyce love one another. There's like a mutual fan society, mutual admiration society between these guys. Now, Manon, could you do the view full screen mode for us, please?
Oh, sorry. Yeah.
Perfect.
Here we go. Sorry.
And before we get started, Manon, I think something which isn't in your presentation, but which I think is important is, can you speak just a little bit about your own personal experience in helping people with acne? This is not an abstract subject for you. You've had very much a hands-on experience in this area. Can you just briefly talk about what you've done and what you've studied in this area before we go through this presentation?
Yeah, actually 40 years ago, well, 1982, I started doing aesthetics. And I will always remember back in the days, we didn't have much to work with, especially on the aesthetic side, not into the medication side. So I have to say, came a long way, and this is where my expertise came. So of course, I studied the skin, give a lot of lecture around the world in the dermatology segment, researching everything that there is to do to make a difference in healthy skin and not to occur or not to, have acne manifest. Because I've seen cases personally myself, which I wouldn't disclose her name here, but one of my first case of severe, vulgaris acne. Basically, you're going to see in the stage, it's basically a grade 5 with, that's tried everything. I mean, you name it, they've tried everything with 5 series of Accutane. And it's quite shocking to see that, how much damage we could do. But now today we have so much more opportunity in treating acne in a healthier way, I'd like to say. And we can basically change people's life. And I have to say that this year, not this year, but since pandemic start, we see so much more acne. So I think it's going to, a lot of product development in that specific category because everybody has a case or is living a case of acne because of this mask that we're wearing every day, right? So it's been quite some time. So I've been in the education segment and of course R&D since 1995. So we definitely have a lot of experience in acne. And of course, great people like Dr. Farah and many other dermatologists, we are able to learn so much more about the skin.
Great. Well, your fans are already in the chat saying how glad they are to see you. So let's give them a treat. Why don't we get started?
All right. So I'm going to go a little bit on the outline of what we're going to cover. So the first is the key facts. What is it that we need to know and how does it occur? What are the different stage, or we basically say grades of acne, causes of acne, and also I don't like to talk specific ingredients. You'll see I'll go just very brief because there's so much complexity and opportunity when you do product development. But we're going to have a quick view on the famous one, let's say. So let's go over the key facts. So what is acne? So we know that it's a chronic inflammatory skin disorder. We do see the visible symptoms like, blackheads, which are comedon, either closed or open. We see the closed comedon, or whitehead. We see pimples, which are papules or pustule. So when the infection takes place, and we'll see that a little bit further. Who gets acne? Everyone gets acne. It doesn't matter the Fitzpatrick, the skin color. It doesn't matter who you are, if you're young or old. Of course, we see a lot more in the puberty time, but everybody can get acne. And again, I feel so bad because there's so much that are developing a lot more that never had a symptom of acne before, but because of that mask that we wear on a day to day, and people that wear that mask all day long and have maybe a genetic predisposition, they develop acne, and they didn't before. So it just makes it worse. So we'll talk a little bit about that. And of course, it is more common at the puberty. We said that is due to the DHT. So we have a hormone, an androgenic hormones that kicks off and increase the sebaceous gland. We're going to see that a little further. So what happens is that this at the puberty time, specifically, we have that androgens. So those, hormones that are causing the sebaceous gland to be bigger, causing more oil on the surface of the skin, unbalancing the pH, and then everything becomes wacko. We start developing, build up toxins, and of course, dead cells, and then acne takes place. So we see it a lot more. This is more like the vulgaris acne. There are different types of acne. I just want to just open, we're not going to talk about all the different acne, especially not in 20 minutes. But that's why it's important when you meet, with product development to discuss what is it that we're trying to target, what age group. And we see more and more, of course, acne rosacea. So acne rosacea has a different opportunity and different bacteria. We're not talking about bacteria, we're talking about mites proliferation. We're talking about these outbreaks that occurs when you have redness. So if you flush and blush easily, right, you may have a lot more mite, like those microorganisms that lives on our pH of the skin, and then maybe will cause what we call those little papules onto the surface of the skin and cause acne rosacea. Different than vulgaris acne that we see at the teenage time. So we'll go through this, but let's face it, 8 most common disease. Can you imagine? So 8 most common disease in the world. 1 out of 3, I'd like to say 1 out of 2 gets acne now since pandemic, and more than 600 million worldwide develops acne. And that's recorded. There's a lot of unrecorded cases. Where can it appear? So what you need to remember is that where the sebaceous gland that's where acne takes place. So of course, when we talk about vulgaris acne, we see it more occurring a lot more into the face, where you have a lot more sebaceous gland. You see it on the back, on the shoulder. That's where mostly the focus takes place. There's different types of acne, different types of bacteria and infection, and that we're not going to cover today. But mainly the most popular acne is vulgaris acne, and that's what we're going to talk. And what we see visibly is we see inflammation. You see those pimples. You see like papules, pustules, those pimples that's not so nice, sometimes cystic, or nodules, like bumps under the skin. And you have some skin damage that may occur due to the development of acne. So it may cause acne scar and post-inflammatory hyperpigmentation, where you see pigments and you have a hard time to get rid of. So it's not so nice. That's a burden. The worst burden is when you have an advanced acne, like in grade 5, you're going to see later, where you see, that face that I was referring to with a case that I will always remember. People walk next to those people, those faces, and we can't hardly look at them because there's so much damage, so much pustules that's very advanced, and therefore it could affect your life, your psychological life. Your psyche, you become, of course, you have a reduced self-esteem, and you can go through depression, and you can even go, to suicide cases, because you just don't know how to deal with it when it's severe again. So it's really something to consider, and it's a great opportunity for product development. So let's go, and how does it occur? So I talked a little bit about it, but when we have a healthy skin, healthy pores, let's say, when we have a healthy skin, its pH is balanced at 5.5 at the surface of the skin, like upper layers of the skin. But what happens is that the sebaceous gland, the sebaceous gland produces an oil called sebum, and that sebum is produced at the surface of the skin. When we're a teenage or when we go through puberty, the androgenic activity takes place, and then the sebaceous gland may occur and may become bigger. And then it alters the pH. When you produce more sebum to the surface of the skin, it actually alters the skin's pH, and that's when bacteria, pathogens start to develop. But I'm going to go back a little bit. How does it really start, generally speaking? The first thing is occlusion. We have an occlusion like a plug. The sebum that is produced by the skin, we need the sebum. That's what balances our hydrolipidic factors on our skin. So we need healthy sebum. But when the sebum gets altered, sometimes when the cells at the surface of the skin, we call them the ST, the stratum corneum cells that you've seen in my previous presentation, they don't shed as much, and somehow it creates a clog. The combination of that clog may be dead cells, maybe cellular debris, maybe oil, maybe so many factors that make that plug. And when there's that plug, unfortunately, there's bacteria that proliferates. When we say proliferates, we say multiply. So we all have bacteria in our skin. We need that. We need bacteria in our skin, and that's in good balance. It works well. That's what we want. But what happens is that the pathogenic bacteria kinds of concentrate when there's an occlusion, when there's no air, because they're anaerobic bacteria. And therefore, as soon as there's no air, no oxygen, they multiply. They develop like a party. And that's when the inflammation takes place. So let's keep in mind that, yes, it starts with dead cells build up. It doesn't shed. Then bacteria, pathogens, pathogenic bacteria proliferate, means multiply. And then, of course, they produce toxins called porphyrin. Like porphyrin, that porphyrin causes, unfortunately, an inflammatory response, the cytokines. So they cause that redness that we see at the surface of the skin. And then it goes into white blood cells. Our white blood cells comes and fight that bacteria, because let's not forget that the skin's main function is protection. So if we have that protection, we're good. So because this bacteria concentration in that where the plug is, somehow the skin is like want to react, and basically the white blood cells comes and fight that bacteria, thank God. And that's when you have your pimples that are red. And then when your your white blood cells win, somehow it extravate, it pushes out and causes a pus. And that's what we call pustules. So those are pimples with a white head on top. So it, like pus basically begins to form. And unfortunately, as it degrades, cystic or nodules may take place. So just infection, basically the eruption of the walls takes place. The bacteria gets to be spread, pathogen bacteria. And that's really, it becomes severe and a lot harder to treat. So if we go quickly, look at the stages of acne. So it goes into grades, right? So there's either a closed comedon, that's when it's, you don't see your blackhead at the surface of the skin. And that closed comedon contains bacteria. And if you look at an open comedon, it's still in grade 1, right? We're still in the first stages, if you like. But the blackhead is a different composition. You find pigment. You find, of course, cellular debris, like we said, sebum that's oxidized, and of course, bacteria. And this kind of form that plug that then starts with all the inflammation, as we discussed. So that's the first stage, or first grade, sorry. Then we go in grade 2, where we have a papule. So that's a pimple that's red. It's not turned into pus yet. But you can see the inflammation. Of course, the sebaceous glands are, in most cases, not all cases, of acne, are increased in size. So the receptors have been increased due to androgenic activity, and they produce more oil. Therefore, they're opening up the pore. Literally because of the composition of the sebum, it's not healthy sebum. It's not healthy oils or healthy essential acids anymore. It's just kind of getting stuck there with your dead cells, and that turns into a papule. So that inflammation that we talked about. And then a pustule, that's when we have the pus, and you can see all, of course, not only the pus, but you see your white blood cells, your bacteria, and the inflammation takes place. You have a lot of redness, sometimes soreness, and that's when it turns into nodules as well as cysts. So really, that's where the rupture of the follicular canal and the sebaceous gland wall basically erupts, and that's what causes all this bacteria to continue to multiply and infect more of the surface and cause all these bumps and often painful bumps, inflammation. So that's how it is. So grade 1, your blackheads, right? They're really not inflammatory, but there are, because at the bottom of the, since there's a clog, there's an inflammation here. So that's why it's called inflammatory skin disorder. And then grade 2, pustules, nodules. With grade 3, you see it's bumpy, and grade 4 and 5, when the cyst, basically the infection is erupted everywhere, and you don't want to go in this stage of grade 4 and 5, because really a lot more difficult. So you can take it in time. So if you're predisposed to acne, you really want to make sure that you control the acne in time. So what are the causes of acne? So acne, basically, we start by the overproduction. I mentioned earlier, we have that sebaceous gland that produces the sebum, and we need that. But when in cases that you have an overproduction, that means that sebaceous gland bag is bigger, and it produces that excess oil that we don't need, that grease at the surface of the skin. And of course, dead cells accumulates, and that's when it all gets clogged because it's not healthy fatty acids. So that's why when you develop products, you have to consider which part of the acne you're developing as a product development. When the sebum overproduction takes place, we know that there's a direct link to stress that could affect your entire body. Chemicals like retinoids, sometimes other chemicals like detergents, like surfactants, that are actually interrupting the hydrolipidic factor of your skin cells, affects pH, and then everything goes wrong. And androgen sensitivity. So if you're genetically predisposed to acne, or you're taking some medication, antibiotic that triggers the androgenic activity, then of course, you see a lot of people that do, for example, physical exercise like body weight lifting. If they do body weight lifting, they have a tendency to do more acne. So it's just a sign that yes, the androgenic glands are a little bit more sensitive, or unorganized, overproducing, and maybe trigger acne. So what we also, what are, if you want the proliferation of pathogen, how do they actually proliferate, is the pH unbalance. So we said the skin's healthy pH is 5.5. So as soon as you take your shower, or you go in the shower, water's pH is 7. Already it's off. Maybe you and me, it's not going to matter. But certain cases, it will matter because it affects the microbiota. It affects your microbiome symbiosis. So it's important to keep this acid mantle, our protection, our skin protection, healthy, and always maintain those environment of healthy bacteria together with the small pathogen in a healthy form. And this is a very great image to show you that we have bad bacteria into our skin. We have that. So everybody has bad bacteria. So those pathogens, the Bacterium acnes, which includes the Propionibacterium acne and the Corynebacterium acne. So those are the little bugs that are pathogens. We have them here, part of our protection, our immunity, part of our biofilm or flora of the skin, microbiota. So it's important to have it in balance, right? What happens is that if it's unbalanced, meaning sometimes people use harsh chemicals on their skin or even alcohol, you can see it on hand sanitizer. You use hand sanitizer, which really disinfect the whole surface, and your pH gets off. So that's how it gets unbalanced. And those pathogens you see in small quantity become bigger quantities, and they proliferate, they multiply, and it doesn't stop. And that's when you have an infection that needs to be under control. So be careful with those harsh detergents. Sometimes you see, this is great, but maybe the surfactant can affect your skin. So pH unbalance, also there's the interruption of the microbiota. I mean, how do we interrupt the healthy, let's say, protection or biofilm of our skin? We maintain the skin's pH, but also genetics. So 50% of chances, like 50% of chances that if your mother or father had acne, you will get it. Also hygiene, lifestyle can affect your microbiota. So antibacterial soap, we talked about surfactant, oxidized products. Sometimes we buy a cream, spend so much money for that cream, and we keep it for years. And maybe it produced that kind of chemical. It releases chemical within the surface of the skin that turns into ROS, reactive oxygen species, onto the skin and affects your skin, and it alters your entire pH balance. And of course, we talked about certain alpha hydroxy acid with high concentration, low pH may interrupt. Maybe you want to interrupt if you have a condition, but you need to have all of this in consideration, as well as comedogenic products like even lipstick, red lipstick. The red dye D and C specifically can cause blackheads, comedon. You see that sometimes around the lips, or product based with mineral oil, etc., can actually cause that kind of unbalance. And then, of course, how do we introduce more bacteria or more pathogens into the skin? Sometimes we touch our skin all the time, and that environment is not healthy. It's off, the pH is off, you will break out. Blackhead removal, the more you pick and also you touch the skin, the more contamination may take place. Working in a dusty or polluted area may cause more of the alteration of your pH, and of course, make trigger heat and sweat. Some of those pathogens love to heat, to live and multiply if pH is off, of course. So that may affect. Eating too much sugar, like alcohol, will of course enhance and trigger more of this infection proliferation. So basically, I don't want to go into ingredients. I really didn't want to go, but of course, in formulation, we have so much to consider. And before I jump into this, I want to reemphasize that, yes, we're going into, when we formulate, we're going into a healthier respect of the environment. So we want to go more green. I want to say that there's so many plants that are not explored that we use today that have an amazing effect onto the skin. And there's so much opportunity. It's how you actually formulate and the synergy of the plants that makes a difference. But one thing for sure, you want to make sure that the skin shed without causing irritation. So we use a birch bark, polyhydroxy acid can be used when they're gentle with a pH that is regulated. What you want to destroy pathogens like the Cutibacterium acnes. Of course, you'll use salicylic acid. It's the one common wow effect with a certain percentage regulated to be so affected. Different essential oils that are very beneficial, like tea tree and thyme, and there's so many others, and how it's actually put together, you also make a difference. Then, of course, restore the balance. You want to bring good prebiotics, like food, to the skin for the good bacteria in order to be able to fight like soldiers against the bad bacteria. So oligosaccharides, chicory, there's many other good prebiotic that we use in the plant segment, and so much. I would like to have like 100 plants up there to show you and how we can actually work with one another and with also synergies. How to remove the sebum surface, like to mattify the skin. Tea tree biopolymers exist. How to hydrate, of course, hyaluronic acid. You want to use an antioxidant, essential fatty acids that are not going to clog your skin, more like the dry oils, because there's still, you can't strip the skin from its natural oil. So that's important to keep in mind. Of course, to regulate or reduce the sebaceous activity or regulate the sebaceous flow, we use zinc PCA. Reduced inflammation authorin is amazing. Calendula, St. John's wort, and so much more. I hope that was not too intense, but I hope you enjoyed that.
Manon, thank you very much. When you talk to companies that are interested in going in this area, what are some of the misconceptions? Are there any misconceptions that people have about acne when they think about treating it? So for example, when you spoke with me, you mentioned that when you were treating this very hard to treat patient, you actually put oil on their skin, which seemed to be counterproductive because they had oily skin, right? That was plugging their pores. But can you help me understand some of those kind of misconceptions that you feel are out there that we need to fight through?
So of course, we always say, oil-free products, and we will develop, for example, moisturizer using gels. But sometimes, when you understand the physiology of the skin and how the microbiota, how the pH, how the entire systems work, you can actually address that instead of just stripping all bacteria and then have to deal with the rebuilding of the immunity of the skin. It's not so easy. So when I referred to this conversation, I talked about using pure cold press oils because this was a stage 5 acne was with a dermatologist. And of course, when grade 5, it was so severe that we couldn't even touch the skin. That client was just screaming. It was like craters, it was really, really bad. So by using oils, the skin is there to defend, protection. So if you use harsh, it's going to defend even more and maybe produce more sebaceous gland. So we always have to consider that in product development to respect the integrity of the skin. But it's such a complex question. I'd like to go in so many opportunities, but I know I don't have much time. But I hope it answered your question.
Thank you. So now that you have heard Manon speak and you realize that there is probably 1 billion people out there with various forms of acne, everything from, grade 1 and 2, which is more of a nuisance, all the way to grade 4 and 5, where it's having a genuine impact on people's quality of life and mental well-being. It's a big and highly symptomatic market. It's not like high blood pressure where you have no idea you've got it until you end up in the ER. So people are seeking treatment. It's an attractive commercial market to go after. So now that you've seen this and the unmet need, you're probably thinking, how do I go about developing a product in this area? Well, look no further, because Sarah is going to give you the 101 or the 411, depends where you live, on how to go about and the things you should think about as you develop a product in the area of acne. Sarah, let's go over to you if you want to share your screen.
Yeah, just give me a second.
Now, Sarah, before you start, just very quickly, how many companies have you personally helped with in this area? Just give us an idea of your experience set, or on an average year, how many companies you work with as they develop
I think
products?
This year there's definitely been an increase, I would say, over a dozen companies that are trying to find solution to treat the symptoms of acne.
Great. So you're in the trenches with folks. So what you're going to talk about isn't theoretical. This is, you've got the scars on your back, so to speak, the non-acne scars. We've got the scars on your back from having done a dozen projects a year with clients to tell people, how this is all going down.
Yeah, so I'm going to basically introduce product development at a high level so that we understand some of the key decision points and consideration that brands have to consider in their decision-making process. So we'll look at some key decision consideration, but we'll also look at some core principles in formulation, and then really showcase a comprehensive solution to treating the skin ailment. So first, we have to understand what the brand's intent is, what they want to achieve, what their goals are, and what's important for them to basically communicate to their target audience. And that will allow us to determine whether we do a cosmetic grade solution product line or medical grade. So if we start with a cosmetic grade so that you guys understand the two different opportunities, is that here we're providing a solution that addresses the symptoms of acne. So most of the population, they will develop acne within grade 1 to 3, so mild to moderate. The limitation here on a marketing level is that you can't make any hard claims. So you can't say that it treats acne or that it's an anti-acne solution. You can say things like it minimizes, the appearance of blemishes and whatnot. The opportunity is that there's really no registration or low registration fees, so it's less costly. That also depends, of course, on the country of sale and where you decide to market that line. And you don't have to go into the cost of doing any clinicals to show scientific data that you can treat acne. So of course, minimizes delays, minimizes cost, and it gives you flexibility in terms of ingredients, choices, and formula. When you go into the medical grade, this is a drug category. So here consumers are, dealing more with moderate to severe acne cases, so grade 4 to 5. And here the competitive advantage is that you're able to make some solid regulated claims, like this is an anti-acne solution, this treats acne. You also have to bear in mind that in order to produce those types of products, you have to find the right OEM manufacturer that has the proper license to produce OTC grade products. And of course, there are some severe or considerable, I should say, costs when you want to do product registration, as it falls under the drug category. And depending on the country of sale, this will, be different. And of course, it does affect delays in terms of your project. And here, the ingredients are those really that are limited to the ones that are approved by the regulatory bodies.
Sarah, can I pause there for a second?
Yeah, sure.
Let me pause there. Let's just go back. A couple of things. What's OEM? You mentioned OEM. What does OEM stand for?
It's just a manufacturer. So people that manufacture right from the concept to shelf. So contract manufacturing, custom manufacturing, or they provide even some in-stock opportunities as well.
Got it. You mentioned that going the medical grade route is necessary. So what would happen if I were to not go down the medical grade route and I boldly proclaim on my website and packaging that my product treats acne? What would happen?
Well, if someone, you can get potentially fined if you are saying a claim that and you're not appropriate, how should I say, you're not registered under the appropriate category. There are some fines that can happen.
But at the very minimum, they're going to ask me to take my product off the shelves.
Yeah, exactly.
Okay, so that inventory has got to be basically destroyed. Got it. So fines aside, I'm just taking a risk on my inventory, and then I'm open to lawsuits.
For sure. And of course, like it lacks authenticity, so you don't want to, that just brings such shame to your brand that you wouldn't want to go down that path, I don't think.
Got it. Last question is, you mentioned going down the medical route costs more, has a longer time frame. Order of magnitude, if it costs $1 to go down the cosmetic grade and 1 day, let's say, or a year to go down the cosmetic grade, order of magnitude, what would it cost and how long would it take to go down medical? Are we talking, 50% more, twice as much, 3 times as much?
It could be 3 times.
Order.
Yeah, it could be 3 times as much, especially if you want to go do some clinical studies. It could be quite significant. So it's hard to put a number, but it's much more significant than cosmetic grade category products for sure.
Got it. So it's substantial and noticeable. In other words, you'll definitely feel the pinch. Got it. So if you want to go down the medical route, you really and truly want to be able to make those claims. Otherwise, you're better off just sticking to the cosmetic route.
Exactly.
Got it. Okay. Thank you, Sarah.
No problem. So once you decide which category of grade you want to go into, you then have the option of choosing in-stock, ready-to-market formulations or custom formulas. And both these options have opportunities and limitations. When you go with stock formula, they've been tested, they've undergone all the requirements, and you're also piggybacking on all the R&D that the manufacturer has done over the years. And you have the ability to choose from a vast existing library of formulas, depending, of course, on the supplier, to select exactly what your products, what you want to launch in terms of products. So this already limits and reduces your investment and development time. The only limitation here is that the intellectual property of the formulas do belong to the manufacturer. However, there are supply agreements that could be put into place to protect the needs of both parties. When you go in custom formula, this is where we develop from scratch based on the brand's guidelines and considerations, the formula and respect the concept of what they want to achieve. And here right away, there's going to be higher upfront developmental costs, and it could take over a year to launch your product. So it's a much greater risk. And the opportunity here, though, and the competitive advantage is that you can, own your intellectual property and buy the formulation, the rights to the formula.
Sarah, if you can go back again, question on this one. You got to hit up. Otherwise, people are going to read the ingredient thing and not listen to us. People are sneaky. On this stock versus custom formula, this is an area that a lot of beauty entrepreneurs struggle with. It's often the first fork in the road that they arrive at, and they got to decide which way do I want to go. And a lot of people feel that, by using a stock formula, well, if you're giving it to me, then what's stopping somebody else from using the same formula? And then what competitive advantage do I have? How do you answer that question?
So again, it all depends on the goal and the brand's vision, but you can also, to a certain extent, customize in-stock formula, say by selecting different packaging. So packagings that are not in stock from the manufacturer. Even though that's going to increase a little bit your investment, at least you differentiated it. But the idea here is that, there's not, there's so much competition out there that you want to be able to lay the groundwork to ensure and set yourself up for success. So trying to reinvent the wheel, sometimes it's not the right approach. You want to try to take something that already, has been proven that works, and basically then build yourself up, and potentially in the future start customizing formulations once you've gotten a momentum going. But just on a risk analysis, I always think that starting with an in-stock formula is definitely much more secure. And then once you grow and you increase sales, you can reinvest and some investment into developing more customized formulations.
Got it. So two questions, and I promise I'll let you go.
No, it's
How
okay.
fast can I go down the stock route? So if I came to you and I said, Sarah, I'm in a hurry, and I'm just going to take your recommendations, how fast can you get product on shelf?
So basically, and that's what's great about this opportunity, is that from start to finish, you would be able to commercialize a line with an in-stock formula within 8 weeks time max, where with custom formulation, it could take over a year at
Got it.
consideration.
So it's end of January. If I gave you the green light today, April 1st, I could have my products on Ulta's shelves.
Exactly.
Got it. Okay. Last question on this one.
If you have a connection with Ulta and you
I do.
and you take part of the added program.
Sure, absolutely. I text with Muffy all the time. Last question is, in your experience, who is good for the custom formula de novo? Meaning, who in your experience is the right client to come and say, right off the bat, I want to work with a custom formula? Is it somebody who has experience in this area? Or do you think they're generally people who are naive and just don't know what they don't know?
No, I think, again, it really, if you have the budget and if you're selling into the mass market at places like Ulta, perhaps you want to go down the custom route. But if you're limited in resources and you just want to be able to build a nice line and create some sales, I think the in-stock option is more secure as a viable option.
Great. Thank you, Sarah.
No, it's my pleasure. Of course, in taking consideration stock or custom, you also have to take into consideration ingredients and whether you have some required certifications like Cosmos Organic EcoCert, some sourcing requirements, or even general availability of the ingredients, because all of this together will affect the overall investment and delays of your project. So now when we look at some core formulation principles, it's important that we formulate with the basis that we don't want to alter the skin's pH, as Manon said, because by altering it, you cause an imbalance and you create an environment where there could be some pathogenic growth. You also don't want to dry out the skin, because by drying it, you basically cause sensitization, and then your sebaceous gland go into overproduction of sebum, causing more acne and more breakouts. And also, you don't want to, formulate by including things that will cause excessive oiliness, because when you have too much oil and buildup, then you enlarge your pores, and then that creates comedons. And of course, you don't want to over exfoliate or use abrasive ingredients, because that will disrupt the immunity of the skin. And by doing that, again, you kind of lay the perfect environment for pathogenic growth. What you do want to do is to make sure that you integrate properties that will restore the skin's pH, bring it back to a 5.5. Every time you rinse your face with water's at a pH of 7, so it disrupts that balance. You want to bring it back so that you create a nice environment to basically treat the acne. You want to maintain this healthy balance of good and bad bacteria. And you want to make sure that you regulate the sebaceous gland and improve overall texture and restore hydration. So when addressing any skin concern, I think that you can't think of developing just one hero product that's gonna give you this miracle solution. You have to select well-crafted products that will integrate both short-term and long-term results, but more importantly, ensure that the integrity of the skin is at the forefront of formulation design. So I like to think of formulation the same way as Manon talks about the importance of symbiosis with the skin's microbiome. You want to design well-balanced formulation that will work synergistically to promote the most desirable outcome. So when we look at building out a product line and treating in a comprehensive way acne, we want to include your 5 core components. And that's really your daily skincare routine of cleansing, toning, exfoliating, treating, and hydrating. So when we look at the cleansers, we have to make sure that even at the cleansing stage, we're not stripping the skin, we're respecting the hydrolipidic film, and you're just wanting to remove any dead skin cells or superficial impurities and start providing soothing properties and reduce overall irritation that's caused by inflammation. So you want to avoid, like Manon mentioned, any harsh surfactants in the family of sulfates that would overdry the skin. You want to opt for more gentle surfactants in the family of glucoside that provides that that foaming experience without the negative impact that sulfates do to the skin. And you want to make sure to incorporate bacteriostatic properties so you have a great balance of the skin flora. And usually, in terms of textures, acne skin, we want to opt for more lighter textured formulations like mousses or gels or even micellar waters. If we take a look at toners, I think that toners are highly disregarded and kind of put on the side, but they're really important. Why? Because again, as I mentioned, water is much more alkaline. You want to bring it back to its healthy 5.5 level, and you do that with toners. And you also want to provide that hydration as well in that step and refreshing, and to remove any kind of superficial sebum or debris that left after cleansing. And you also want to provide some soothing and reduce any kind of inflammation. So here you want, and also toners, they have a capability of allowing absorption of active ingredients much deeper into the skin. So you want to avoid anything that's drying, synthetic alcohol-based toners or pegs, and other really across the board chemicals or fragrances. We want to integrate prebiotic ingredients that are going to feed the good bacteria so that it fights the bad ones. In terms of exfoliation, you want to, of course, eliminate any dead skin cells and impurities. We want to work on refining the overall texture of the skin so that we minimize future breakouts. And so it's important to stay away from any, microbeads or scrubs that are very harsh because they could cause micro tears. And by doing these micro tears will cause the proliferation of bacteria. We want to consider integrating various acids like BHAs that have proven efficacy in treating acne, like salicylic acid. And also, like Manon mentioned, that the AHAs, sorry, I have a throat. And so the AHAs, so that to minimize any kind of post-inflammatory hyperpigmentation that could be caused from scarring. So we like to look at formulations that are more enzymatic, that will break down naturally, the dead skin cells, especially for those that have more reactive and sensitive skin, and, not to do mechanical exfoliation that would overstimulate the microcirculation that could cause future breakouts. In terms of the serums, here we're working really deep at the dermis level. We want to destroy the pathogen to reduce the breakouts, to reduce inflammation, to minimize scarring. So again, here we want a complex of bacteriostatic properties, and we want to be able to reduce the sebaceous gland so that it regulates its production. And we want to incorporate keratolytic properties. So keratolytic properties will help cell turnover, and by doing that, will improve the overall texture of the skin. And then, of course, in terms of textures, we want to do, liquid textures that have lower molecular weight because they're able to penetrate deeper into the skin. And last but certainly not least, we want to hydrate and purify with the moisturizer, and make sure that we regulate sebum production and provide mattifying properties to reduce a shine effect for those people that suffer from oily skin, and overall, brighten up the complexion. And we want to stay away from anything that would clog pores, that would be too heavy, or sensitizing agents. And again, back to a static complex that have detoxifying properties are interesting here, and anything to also promote soothing benefits and antioxidant properties. We want to stay into textures that are very lightweight, like gels, that feel very refreshing on the skin. So this is really, the core building blocks. I think by starting, this is kind of the heart of your line. And then once you get going, you can create more innovation into integrating masks and whatnot. But I really believe that this is, the building blocks to a healthy line. Thank you.
Sarah, earlier you mentioned when you were talking about toner, micellar water. What is that for those who may not be familiar with it?
So toners is just used to basically, after you cleanse, it's kind of like in a mist form. And it's really used to basically restore the balance of your pH, but also create like an opportunity for active ingredients to seep deeper into the skin, because it's kind of like when your skin is dry or too dry, this is kind of allows it to become more sponge-like. So it's really something that it has to be integrated into a healthy skincare routine.
Got it. And this, you mentioned micellar water.
Yeah,
maybe
the micellar
I thought
waters,
it was with
you
toner.
don't need
What
to
is
rinse.
that?
So micellar waters are basically liquid form. They cleanse the skin. They do everything that a cleanser does, but you don't have to rinse it off.
Cleanser.
Yeah.
I see. Got it. Okay. Thank you very
So
much.
it could skip the toner if you use the micellar waters, because they would integrate the properties right off the bat of restoring the pH without having to rinse it with water.
Got it. Last question, Sarah. In your extensive experience working with clients in developing products, you mentioned some best practices. Are there some common mistakes you see people making that you kind of want to scream and just say, don't do this? What is it? Is it going the custom route? Is it picking exotic ingredients that are hard to source and it ends up doubling their COGS? Is it indecision around their packaging? So formula's all ready to go, but they're stuck on font sizes. What is the common things that trip people up? So if I'm thinking of going in this area, I can take your advice and avoid it.
There's a variety, but I really do feel, based on what I've seen, is people thinking they can make something so much more unique and go the custom route, when really, what's in an in-stock category has probably over 35 years of R&D behind it. So, you end up having a large inventory to move around, and the delays of even just formulating is extensive. So I really think that would be, if you're an established brand, it's one thing. If you're an established brand, you've already got traction in the market, custom route, for sure, no problem. But if you're new to this, I definitely think that it's one of the most common mistakes that I see.
Got it. Thank you.
Yeah.
Ladies and gentlemen, we're now going to move to the sunny tropics of upstate New York. Joining us is Dr. Joyce Farah, a lady who, along with her brother, Ramsey Farah, MD, went down this very path. They decided one day that, they're bored. They don't have enough to do with, acne becoming an uncontrolled problem on top of COVID. Like, you know what, let's just go develop a product together. It's fun, right? And they did that. So Dr. Joyce is going to tell us about what they did, who they are, what they did, and what they learned. So Dr. Joyce, let's see if we can make technology work for you. Am I going to be presenting for you, or are you going to do it yourself? And you're muted, by the way.
Oh, okay. Can you hear me now?
There we go.
Okay,
absolutely.
No, I think I'd feel better if you just did it for me.
Sure. Happy to.
Thank you. So actually thank you for having me on this panel. The Manu and Sarah's presentations were excellent. I hope I can live up to your standards. So a little bit about our practice and how we came about to do things. We are a family practice in terms of family members in the practice, but we are an all-inclusive dermatology practice. And this was started by my father, Dr. Fuad Farah, back in 1980. We actually immigrated to this country in 76. And at that time, he joined Upstate Medical University, where he was a professor of medicine and the dermatology section chief. And in fact, he was the dermatology section. Throughout his career, he was always interested in basic research and learning and innovation. And he was very innovative, both in medical treatments and also in adapting cosmetic treatments and supportive products for the medical conditions that he was treated from very early on. So he retired in 2013. So next slide, please. But my brother and I had the privilege to work with him. So my brother, Dr. Ramsey Farah, is a board-certified dermatologist and dermatopathologist. I would probably say he's he's smarter than me, but I'm much cuter, just so you all know that.
Obviously.
Yes. So he joined the practice and also part-time at the Upstate Medical University, where he has appointments in medicine, family medicine, ear, nose, and throat, and pathology, because we both teach very much in those departments. He is now the section chief of dermatology, and that section includes himself and myself now. He joined in 2000, and I came along in 2007. And I'm a board certified dermatologist and trained in photodynamic therapy. And again, we do spend some time at the university clinic because we feel that's very important. That's a very different patient population who sometimes is underserved. But in addition to that, part of our mission is to teach future medical students and residents in the above specialties to deal with common dermatologic conditions. So I joined in 2007 after a career as a teacher, and I didn't like to have summers off, so I went to med school. My brother had the good fortune of marrying my sister-in-law, Michelle Farah, who is actually a really big force behind our cosmeceuticals or our aesthetic practice, because she has the background to really delve into the biophysiology and the supportive studies, which is really important to determine what products are actually worthwhile using. Because, you know, a lot of times the FDA does not require as stringent studies for cosmeceuticals or over-the-counter products as they do for prescriptions. And my brother and I don't have time to go through this, so she has been very instrumental in going through that and helping us navigate it. So we have an all-inclusive, it's a one-stop dermatology practice. We do adult and pediatrics, we do general derm surgery, we do the specialized Mohs micrographic skin cancer surgery. We have in-house derm pathology. We do photodynamic therapy for basically skin cancers and precancers, but other things. And we do have an aesthetic practice. We just listed here just a few things. We do have 2 part-time estheticians that do work with us. So it's a one-stop shop. Next slide, please. We missed putting our main location, which was Syracuse, but we do have ancillary offices, and we did already mention the university practice, which we really enjoy doing. So,
Dr. Farah, quick question. How many acne patients would you say, just so the audience understands, if you were to estimate, how many acne patients do you treat in a given period, say a week, a month, a year, whichever period you feel comfortable estimating, and it will multiply from there?
Probably in a week, between like our private office and the university practice, I would say we'd see anywhere between maybe 30 to 40 acne patients. It's pretty
per
common.
week.
Yeah.
Wow. Okay. And then second last question on this. Manon, talk to us about the various grades of acne, starting at grade 1 all the way to grade 5. Does your practice skew a certain way? Are you seeing more the severe patients, or are you seeing a fair balance between grade 1 through 5?
So this is a very interesting question because I think we see a fair balance between grade 1, what we would consider grade 1 and grade 5. But we often see patients who maybe have grade 1 and grade 2 who think that their acne is a grade 5.
I see.
So we see a nice variety, but and I was going to touch upon this a little bit later. When you're treating acne, be it with medical treatments or aesthetic treatments, you have to cater a little bit to the perception that the patient has of their acne, because we do have some grade 4 acne patients who don't think their acne is too bad, and they're here for a mole check and they don't want their acne treated. So we see the whole.
Got it.
Okay.
Thank you.
We do carry, actually, for a very long time, we've carried some 2 established product lines, but we decided that, we would like to start our own product line. And because I think that's part of a comprehensive approach to skin health, which can include everything that Manon and Sarah had already talked about. And since we do aesthetic procedures and some cosmetic procedures, having our own line can also help to maintain the treatments that you are doing in office. And I think that's crucial. You need to do that no matter what the treatment is, whether it's like a Botox or a facial or a laser, etc. And a lot of patients will come in because they're overwhelmed with their choices. So they may be coming in to have a skin cancer checked and their mole checked. And at the end, when we say everything's okay, they're like, oh, can I ask you about skincare? Because they're finding it very difficult to navigate the plethora of choices that's out there. And so it's important to have a trusted relationship where you can kind of guide them down to what they want. And I always try and listen to patients to see where they're at in terms of how much they want to do and how much they want to spend. So I think there's nothing worse than trying to give someone an $80 night cream where they really just want to go and get an over-the-counter product that costs $25 because they can't afford something. So you have to listen. You really have to listen to what your patients are trying to say. So we decided to actually go down the already established line versus our own line, because we have a lot of experience with compounding topical treatments for various diseases. Derm's wheelhouse has been compounding ever since the age of the Barbers and Surgeons Guild back in the day.
Dr. Farah, for those who don't know, what is compounding?
So compounding is where you take different active ingredients that are available as commercial powders, and you put them together to treat a certain disease entity that you want. So they are usually synergistic, and you put them together and you put them in a base that allows for whatever it is effect that you want. So instead of giving a patient 3 different creams to use for their acne or for their psoriasis, you're able to put it in one. It makes it much more elegant for them. It's actually a little bit cheaper in the long run, and it increases compliance. But compounding is not so simple as taking the powders and putting them in a mortar and pestle and then just mixing them up and putting them in the tube and say, there you go. There are specific compounding pharmacists, not any pharmacist will do this, because you have to know the characteristics of the active ingredient. You want to make sure they're synergistic, and so they work together and don't actually cancel each other out. You have to make sure you can easily emulsify them, which means you can put them into an elegant formula so they don't precipitate out. You need to make sure they have enough good preservatives, if you will, so you don't cause infections with bacteria and fungi, and you have to make sure they have a certain shelf life. So it's very complicated, and we knew that if we were going to do our own product line, like Sarah said, we would have to go through extensive testing. And we weren't at the point right now where we wanted to do either the time or the financial investment. So next slide, please. But the key guiding principles, regardless if you want to get stock product or you want to do your own, is the quality of the ingredients. And this has been a big issue because there are a lot of medical compounds or powders or ingredients that are made overseas. And sometimes the regulations overseas are either hard to enforce or different. And there have been certain over-the-counter and actual prescription medications that have been pulled because they've been found to have carcinogens in them. So we wanted to make sure wherever we were getting our products from, the source ingredients was the best quality that we could get, which ties into the efficacy of the product. Because if you have a good quality product, you are going to have the end result that you need versus something that's substandard. And the other thing that we really were considering was doing products that we could use standalone, or that we could use in combination with what we do on the medical side. And a big thing for us was to ensure that these could be. We had a wide range of costs, so that patients can have. There's a little bit of cheaper and more expensive, so everybody could actually buy something or afford to get something, and you can't exclude anyone. So we were just trying to keep that also as well. I think that's important. So, we're talking about acne here. So this is where I was going to allude to the perception of the patient. So mild acne versus moderate to severe acne is definitely, you can grade that medically by looking at a patient. But then there's the perception. And the perception of how bad a person's acne is comes from the patient themselves. So you need to cater what you are doing as well to how distressed the patient is about their acne. So for mild acne, if someone comes to us on the medical side because they have mild acne, they're on the medical side because their acne is bothering them. So we tend to send them to the aesthetic side and give them products, etc. But we also tend to treat them medically. When someone comes with very severe, moderate acne, we actually are fairly aggressive with our medical treatment because we do want to prevent scarring. Once you start to have acne scarring, it is exceedingly distressful, difficult, and expensive to reverse. So having said that, that we always will send our patients off or recommend that they have, at minimum, a cleanser and a corresponding toner to balance their pH. And from then on, depending on whether, they're a female or a teenage boy who washes their face with dial soap and doesn't want to bother, you can add onto it. Next slide, please. So, when we first started this, I just sat down with a piece of paper and just started writing all the possible ingredients we can use for acne or some of the other conditions we were looking at. And then I just looked at my sheet of paper and said, this is insane. So I put it aside, and we decided to focus on 4 things for our product line. We're going to do lines for acne, for rosacea, for melasma, and for aging skin. And that's where we were going to stay. So we looked at all those 4, and then we said, okay, what active ingredients can we use that can cross across all of those entities or all of those diseases? So we did a list, and this is by means not an all-inclusive list here because I didn't want the slide to be big, but basically we were actually very concerned about the pH balance because a lot of things that we do on the medical side can change that. Furthermore, people's lifestyles, the pollutants in the environment, UV, everything in our environment can push your skin pH off. We are looking and we are waiting because the studies are coming about and also actual probiotics that are going to be starting to be used in skincare, and those we will actually incorporate as soon as we have enough studies as to what kind, etc. We do Antioxidants are going to be great for any condition that's inflammatory. So that will include things like the nicotinamide and some other ingredients. We do use some alpha hydroxy acids, but again, and we do use retinols. I think everybody who has acne should be on some sort of retinol. How you do this and the concentration that you do this can vary. But retinols actually do have some also anti-inflammatory properties because they do go into the cell nucleus and they can change and normalize a little bit of the skin. You have to be careful because you can overshoot with these. So we tried to do things that we can put across different skin types and different ages. There's a huge list of of ingredients that you do not want to have. Mano mentioned dyes. I totally agree. There are formaldehyde releasers in almost every single personal care products. Fragrances are very irritating and allergenic to people. There's a big push in the public to stop the PABA preservatives, although, you know, PABA is not as bad as like a formaldehyde releaser. However, we were trying to keep things as clean as we could. And then, you know, you have to, like, I alluded to this when we were talking about compounding for medical prescriptions, but you do have to be a little bit careful about how you are giving people different ingredients because you want to keep everything balanced with the effect that you want without causing too much irritation. And the product types are exactly what Sarah said. We're starting off with cleansers and toners, exfoliants, serums, moisturizers. We have antioxidants. And of course, we're a derm office, so we have sunscreens. And there are back to active ingredients or avoidable ingredients. We have opted to go with zinc and titanium based sunscreens. And also I would add sunscreens that have iron oxide because iron oxide can block blue light, and blue light is starting to be implicated in a lot of pigmentary diseases and skin aging. So next slide, please. So we had to look for a reputable manufacturer because, again, we don't want issues with quality or where things are sourced from. We did want someone who has all the required certifications because we are not going to get into that at this point. And for us, it was important that this manufacturer be based in North America, which means like US or Canada, for two reasons. First, the regulations here are a little more stringent and we're aware of them and we're comfortable with them. We have easy access to the manufacturer, be it if we want to go visit or on the phone or Zoom or however. And actually, another very important consideration for us was a carbon footprint of what we are doing. So if we have to ship things across the world, that's a much higher carbon footprint than if we have to do it a little bit more locally. Next slide, please. So our formula selection, I think I touched on a little bit, so I'm not going to go too much over that. But basically, we went from diseases or conditions we wanted to treat, and then the ingredients, and tried to cross them and use things that you can use across the board, so it was more manageable. So this was the fun part where we did the sample testing. So since this was an already available formulations, we were able to pick and choose, and the manufacturer was kind enough to give us some samples so we could try. And we had all the office staff, who's basically all women except for my brother, ranging from early 20s to late 60s. And we included my parents and my in-laws, who are in an older population. And so we all rated the products and based on, you know, elegance, fragrance, efficacy, irritation, etc. And then the three of us got together, went through that, then we brought our esthetician in and we came up with the products that we wanted to use. And that's how we formalized our product line. With room to expand. And again, I have to emphasize, I think it's best to start small and to grow as you see how it develops. Surprising to me, the package design was one of the most difficult things. It was easier for me to figure out what actives I wanted because the package design has to reflect the ethos of what your practice is or what services you want to present. It reflects basically you. And so that's something you have to really think about. And then there are things like font and size and color, and do you include your logo, and where do you put the product name, etc. So, again, working with an established manufacturer, we worked with them and we were able to get various examples of potential packaging design, which actually made it a little bit helpful. But you have to be able to imagine, when you see something on a 2D or on a slide, what it's actually going to look like on a round package. So next slide, please. This is what we ended up with. So at first we tried to include our logo. It was too crowded. We wanted to include the MD because we really are a medical practice. So placing the MD was not that easy, I have to tell you. It seems like it's simple, but it's not. And then we wanted to make sure we included dermatology and cosmetics because that's basically what we are doing. And the color scheme, I think, was pretty modern and subdued and can be lasting. So you can see it on the different sizes of the white bottles. You can see it on a darker bottle, and you can see it here on a see-through container. And I think it just gives a clean, sleek look. And again,
Dr. Farah, what's in the bottles? What's the line include? So you have toner,
so we have
cleanser.
a toner. I don't think this includes everything. It's just a little sample. We do have a toner. This is one of the serums. This is a vitamin C antioxidant. This is an eye cream. Oh yeah, we did add an eye cream because everybody needs an eye cream regardless of their disease state. And these are some of the moisturizers.
And Dr. Farah, these weren't just specific to acne, correct? These were for more broad
these were not
use.
just specific to acne, but that's why, I think when you're trying to formulate a product line, it is good to focus on things that you see commonly and try to incorporate some products that can be used across the board so that your initial outlay is not horrific and that you can move things so they don't sit on the shelf and expire, and it gives people some choices. So we started slow. We ordered enough what we would think would be for 6 months, and it was under 10,000. I think it was around 6,000. We did do a lot of promotions to first move the product and to make our patients aware that we have this. And we still carry the other 2 lines that we have. So we are not our vision is not to exclusively just carry Ferroderm. I think it's nice to give people some choices, and some people really like what they used before. So our feedback has been really broadly positive. I think it's very reassuring to patients and to clients to have your branding on this. They already have a trust relationship with you because they are coming to you. So you already have that established trust as a professional. And if you put your name behind something, that actually is much more reassuring to them. We did make sure we had a varied price range because college students or young adults do not have as much disposable income as people in their 40s and 50s who are working and well established, who may not have as much disposable income as patients who are retired and on Medicare. So, we're trying to make it all inclusive and provide a quality for every patient we have. And we are okay with patients mixing and matching between lines, except for one thing. We don't let them mix and match cleanser and toner from 2 different lines because I think these are really designed to work synergistically. But otherwise, if someone likes a retinoid from brand A, but they like our serum from Ferroderm, we're kind of okay doing that because while we were testing these, I did that because I wanted to see how these things would work together. So basically, you really have to have a clear treatment intent. You have to cater to your patient population, and you have to be very careful with the key ingredients and the quality you're getting. Do not go big. Start small, because you will make mistakes, and there's always room to learn and to expand. And if you make a mistake, that's $5,000. That's not $100,000. Definitely lower developmental risk and reducing time to market and cost, which is what we were interested in at this point. And really think about your packaging design, because that does reflect your practice. And make sure, you stay within a set budget of what you initially wanted. I think that's really key. Also key is to have the right partner in terms of the manufacturer, proven experience, and a long track record, and also someone who's willing to work with a small client like ourselves, because we are really considered a small
Dr.
client.
Farah, do you feel comfortable disclosing who you worked with?
Sure. Is it okay for us to do that? We worked with Derme, actually.
Okay, great. What a coincidence.
Amazing, right? No, and you know what? Because look, we carry some of the Derme lines, and and we're very comfortable. We've had a relationship with them. We've been up to Montreal. We know what they're about. They know what we are about. We did not want to reinvent the wheel. We did not want to reestablish relationships, and we think very highly of them. I mean, I'm just telling you why we went that way. And we're very, very comfortable. So that's the route we went with.
Got it. So if I were to boil it all down, it came down to trust. You trusted them because of their heritage and commitment to this area. You used their products, so you knew what they were talking about. And you're not just some lady whose son has acne and there was nothing there, so she started making stuff in her kitchen sink. You're working with professional compound pharmacies using, medical grade actives, mixing and matching. You are on top of the clinical literature and all the studies that are coming out. You know all the ingredients. And with all that knowledge, your conclusion was, if we're going to do this alone, we got to go work with somebody who knows what the hell they're doing and use their formulas instead of trying to come up with our own. Because you were doing that with the compound pharmacists, and it was just tough.
Right. Well, the difference here was that, as a physician, I can really compound anything I want, basically, right? So I don't have to go through the regulation. I just have to use something that's an FDA-approved powder.
Approved. Got it.
So we knew that if we were going to start from zero, it was just going to be logistically impossible and actually financially a huge burden. We don't have ambition right now to start selling to the general public. We just really want to take care of our patients. Now, in 20 years, do we want to do that? I don't know, maybe. I'm not saying we're never going to do that, but right now, it's not in our wheelhouse. That's not what we're interested in.
Got it. Sarah and Manon, was Dr. Farah a good client?
She's incredible and a lot of knowledge, and it's thank you for all of this, Dr. Farah. That was really nice. I didn't expect that, so thank you.
Thank you so much. It was great.
All right, ladies and gentlemen, sadly, this brings us to the end of our session. It has been informative and a love fest. These folks really do like each other. They work together. They've produced some great products. There's real trust here. And I think what's important is that, especially in Dr. Farah's presentation, you're hearing from a person who's spending every day in the trenches treating patients. So she and her brother and the rest of the people in the practice are seeing a wide variety of acne conditions from a wide variety of patients. Because of their practice locations, they're seeing, students at the medical center, they're seeing older people, they're seeing, people in the middle bracket of the age. I'm sure all varieties of what's causing people's acne, whether it's genetic, age, stress, hormonal changes. And so what I think is key to learn is that with all that knowledge that they have, the path that they decided to take was a very deliberate one in terms of what they wanted to do, what products they wanted to have, what ingredients they wanted to have, and what they wanted in their partner. So I think this is not your average client. This is a very well-educated, knowledgeable, informed client. And I think for those who don't have the benefit of being a board-certified dermatologist or seeing 30 acne patients a week, I think you should take away from this that, you know, going down the path of finding a specialty manufacturer who understands this space and can walk you through your options is critically important. I'm not just saying this because Sarah's my sponsor. I'm telling you this because Sarah's right. This is the reality of the matter. And if you talk to any other contract manufacturer out there who's worth their metal, they'll tell you the same thing. So do your research, make sure you get your ingredients, your requirements down pat, what Dr. Farah said. And as Manon pointed out, don't underestimate the complexity of acne. There's a lot happening there with a lot of different factors that could affect why people get acne and how your product could be received in the market. So with that, I want to thank Sarah for sponsoring this episode, the final episode. I feel our journey is coming to an end. We're going to miss each other, but hopefully we'll be together again. Yes, if you have any questions, feel free to reach out to her at sarah@derme.ca. They're up in Montreal. They would love to see you once the weather gets a little bit better. Maybe you can go up there and see their beautiful facilities. And I'm going to be back to haunt everyone on Wednesday, where we're going to talk about beauty's biggest deals. Last year, billions of dollars of transactions happened in beauty, and they're still happening. In January, we've already had 4 deals being announced. I'm going to have Ashley Barker, Lauren, and Luc Henry, 3 investment bankers, on the show on Wednesday, talking about these deals and what they tell us. And with that, I would like to once again thank our panelists and thank you, our audience, for joining us. I wish you all a great weekend. Take care.
Thank you
Bye.
so much, Tyler. Bye.